Well, the Centers for Disease Control and Prevention now stopping a successful flu vaccination campaign that uses images of wild animals, such as a lion with cute counterparts like a kitten, as demonstrations for how immunization can help tame the flu. During a recent meeting, the CDC staff was told that the Department of Health and Human Services had reviewed the campaign and advised that it would not continue. All of this comes during Robert F. Kennedy Jr.'s first full week on the job as head of the HSS. Joining us now to discuss this and so much more, hey, he's back, Dr. Mena Mirhom, back here on the LiveZone. Always good to see you, sir. Welcome back to the show.
Likewise, Guy. Thanks so much for having me back.
Let's jump right into it. We know that RFK has been really vocal about his concerns regarding antidepressants, in essence, really questioning their safety and long-term effects. I'm curious, your take on what specific concerns does he have regarding this?
Well, Guy, the primary concerns are twofold, I would say, that have been raised already publicly by RFK. The first one is that they are tremendously overprescribed, and this might come as a shock to viewers from a psychiatrist, but I actually agree with this take a lot. Because when you look at the studies that have been done recently, according to the Academy of Pediatrics, there was a study that was done and looked at pediatric prescriptions since COVID, and prescriptions of antidepressants actually jumped by 64%. When you look nationally, we are at a place where we have two things happening at the same time, that we have high rates of depression, anxiety, and increasing rates of medications being prescribed as well. Sometimes that is due to the fact that we are expecting medications to do more than they can. So that's the first part that's being reviewed is, are we relying too much on medication and hoping that they would become the silver bullet for all mental illness? And the answer to that is no, but they can be very useful. The second part he's concerned about is the suicidality or the black box warning of these medications, which is they have to be prescribed very carefully, especially in folks who are 16 to 24 years old, even though we have never seen a case where a medication caused a suicide to happen, but there is a need, there's a black box warning. These medications have to be prescribed carefully and with close monitoring because they can have that impact on young people. So that's the reason for that perspective pull from or re-evaluation from RFK.
Sure. Very interesting. We should also make mention that we have heard a number of executive orders come down since the president has actually been in office, one of which happens to create the Make America Healthy Again Commission, which in essence really aims to assess the role of antidepressants. And so I need to ask, the potential risks really associated with these medications.
Yeah, Guy, that's the thing. Medications like antidepressants are a tool. The analogy I give to patients is that they're like a fork, right? A fork is a good tool to use for dinner, but if you eat everything, if you eat your soup with a fork, then you might make a mess. These medications we know are safe, effective, and can be life-saving. At the same time, for example, there is a campaign right now from the American Psychiatric Association around holistic lifestyle treatments for all kinds of psychiatric illnesses. That includes what we eat, our community, our spiritual care. So medications were never intended to be the one size fits all for everyone. And the risk there is that we rely too heavily sometimes on medications. We might put ourselves in a place where there are side effects involved. But when used in conjunction with everything else, they can actually be life-saving. And that's what the psychiatric community wants to be able to advocate for. So in some ways, we actually agree with RFK in this sense. What we don't want to do is risk access to these medications as well and swaying too far to the other side of the spectrum.
Yeah, I'd have to agree with you specifically regarding the eating the soup with your fork. Does not work at all, I guarantee you. Hey, we're talking controversy, and more controversy. And apparently that seems to be the case when you make mention of Kennedy. In this case, we're talking about one of his most controversial claims is that antidepressants are as addictive as substances like heroin. Do tell, sir.
Yeah, absolutely. This is something that needed a lot of clarification because on the very basic biological truth, this is not true, right? These medications do not bring us to a place of having a compulsive craving or a euphoric high as you would see in heroin. But what Kennedy's trying to get us to is that, hey, we have to be honest that when a person stops this medicine abruptly, they can get discontinuation syndrome, as we call it in the psychiatric world, or some withdrawal symptoms. Now, these symptoms are not life-threatening, they're not dangerous, but it does give us the indication that if you're stopping this medication, please do so slowly with the guidance of your doctor. However, these are not medications to be feared. What we worry about in the psychiatric community is if I'm somebody struggling with depression and suicidal thoughts, the last thing I need is to have this be even more stigmatized than it already is. And for me to feel like, oh, am I doing something dangerous by taking a medication like Prozac? Well, no, this is safe and effective, but it does require a holistic treatment. It is not intended to be done just by itself, like we were saying before.
Yeah, Dr. Mirhom, with that being said, that leads me back to a previous question and or a topic that happens to surround the executive orders. We know yet again that it really could impact current medical, well, let's say their practices in patient access to medications. Can you explain that?
Yeah, absolutely. And this is why we, as the psychiatric community in general, are advocating for this balanced approach, right? Whether we're looking at medications or vaccines or anything of the sort, it can be great to ask questions. It could be great to be thorough and review the science. But what we don't want to do in the interim is say, well, we're going to interrupt things. We saw the backfire of that where with federal employees who are working on aviation or on things that are critical for public health. We don't want to go too far that way. What we are advocating for is saying, hey, remember these medications are safe and effective, but we don't want to limit access because, for example, for the same reason, if I'm a patient who's taking this medication and relying on it to be able to function, to be able to be productive in society, restricting my access to it will not help me. But what will help me is say, hey, listen, understand the pros, the risks, and benefits of this medication, and understand what else you can do to take control of your mental health. That's how we can empower patients, not put them in a situation where they are cut off from life-saving medication.
Yeah, mental health a major issue right here within America. I got to tell you, for me, there's nothing better than perhaps visiting a farm. However, in this case, we're making mention of wellness farms, and we know that's a part of Kennedy's plan. One, I'm hoping you can address just what that is, and two, with that being said, how can one be sure that they can rely on just that?
Yeah, this is another one of the interesting perspectives from Kennedy. At the heart of how he sees addiction as a disease of isolation, or a disease that is where you're cut off from community. Again, a really good part that we love in the psychiatric community, which is that this is part of the reason why 12-step programs that enhance community really work. To be around other people, to have accountability, to have inspiration and guidance is really, really key. If you go too far in that world, though, which is what the wellness farms are, which is removing medication from the equation entirely, that can become dangerous because in Kennedy's exact example in his own life, heroin is a medication, or sorry, is a substance that needs to be treated with medication because the body becomes physically dependent on it. So again, if his perspective on a wellness farm is to enhance community, we can just add a balanced perspective to that of community is really important. Spiritual renewal is key, as he mentioned as well in an interview. But in addition to that, having a well-rounded approach with medication when you need it, having all the tools available to you.
We'll end with this, Dr. Mirhom, and that happens to be the potential changes in medication availability. Is that something that, well, let's say patients really need to be concerned about?
Yeah, this is the part we're holding our breath on, to be honest, Guy, because we want to be able to say if RFK has made that analogy even with food, right? He said, my boss loves McDonald's, so I'm not going to restrict the nuggets and the Big Macs from folks who just want to indulge in that. We're hoping for the same perspective on medication, is that if it's something that a patient wants to have the autonomy to go ahead and go for as a helpful tool in their toolbox, that it won't be taken from them. That's what we want to advocate for, in addition to the holistic approach of what else can we do biologically, psychologically, spiritually, that we as a person can have our whole self elevated and full of wellness, not dependent on one part of the equation only.
Dr. Mena Mirhom. Folks that want to find out more information about you, sir, I see that right behind your right shoulder. How would one go about to do so?
Yeah, definitely. Please feel free to follow me on Instagram there at Dr. Mirhom or come through to my website at drmirhom.com. I would definitely love to be able to share evidence-based mental health information with folks.
Always good to chat with you, sir. Appreciate you coming on the show. Make it a great day.
Likewise, Guy. Thank you so much. You too.